In past videos, we've talked about the mommy makeover and how popular and relevant it is. And we've talked about the basic components of a mommy makeover. Now what I'd like to do is to break it down and go into a little bit more depth. And if that's what you're interested in the different parts but more depth, then stick around and you're gonna hear what I think about it. The breast component of mommy makeover is really interesting, and there are just so many more options than you probably are regularly gonna be given. But we give you all the options, and we think it's important to talk through those options. When I hear a lady start telling me about her breast changes after multiple pregnancies, pictures just start to be produced in my mind, and I get a really accurate vision of what I'm going to see when we do your exam by just listening carefully to what you tell me that you've gone through. But to simplify it, we're talking about a deflated breast for the most part in a post-pregnancy change. The hormonal influence that the breast has been subjected to during the storm of the pregnancy and breastfeeding and things like this, all of that is gone, and that breast gland now does not have that hormonal stimulation. So what it does is it shrinks, it atrophies. That kind of sounds yucky, but the end result is a deflated breast shape. So ladies come in and say, I just want more shape back. And in the process of that, we figure out that they're probably gonna need some more volume. Volume alone will lift your breast. And if false droop is what we call it, pseudotosis is false droop, is the issue, meaning that you just lost a lot of upper pole fullness and all you got left is in the lower pole, then that can be corrected usually by a breast implant, just adding some volume. But we need to be careful. You can't take that line of reasoning too far, which is what I see some in this market, and that is people say, okay, a little bit of volume gives you a little bit of lift. Let's add a lot of volume, give her a lot of lift. No, it doesn't work that way. You just end up with a big droopy breast instead of a lifted, nice shaped breast. So the real wisdom here lies in figuring out how much volume to add, how much lifting to do. And yes, it's come with 30 years of experience with this. So we've learned cause and effect with this, but we'll do your exam, we'll do your consultation, we'll try to kind of crawl in your head to figure out what it is that you're visualizing with your breast. But at the end of the day, for the mommy makeover, a breast treatment, it's usually gonna be some sort of implant with lifting. And that's all done here in our office operating facility. It's an outpatient procedure to be done. You are put to sleep for a short period of time. The recovery is much like what we've described before, 1 week of no vigorous activity, heavy lifting, no straining during that week, but you're walking the night of, you're driving within a day after you've gotten off of any narcotic pain medicine, and you're showering the first day post-treatment. It'll be probably a good 2 to 3, maybe even 4 weeks before you wear that nice, comfortable, supportive, attractive, expensive bra. But you start wearing one when it starts to fit, and will be certainly helpful in letting you know when that's the appropriate time. So if you want more information about breast lifting and augmentation, or just the corrections that you'd like to have after post-pregnancy changes in your breast, give us a call at 205-408-9787 or contact us at clintonplasticsurgery.com.